everyone, my name is Sophia Karki, and today I'd like to share this presentation with you about the mental health of the geriatric population. So a little bit about myself. I'm from Pittsburgh, Pennsylvania, and I'm a rising senior at North Allegheny Senior High School. I have a younger sister and a little dog named Leo. Some of my hobbies include dancing, playing the piano and violin, and making friendship bracelets. I also enjoy volunteering at a nearby senior living home, which is really the inspiration for researching on this topic. In the future, I'm interested in gynecology and possibly even specializing in the geriatric population. So when I first saw this photo, it reminded me of the fact that whether or not we'd like to admit it, each of us is aging every single day. And with aging, oftentimes comes certain stereotypes, like the older you are, the wiser you become. Or in many cases, when you're old, you're weak, you're fragile, and you can't remember anything. But not only are there many stereotypes when it comes to aging, but oftentimes the elderly population is neglected from certain communities. For example, in the discussion of mental health, where teenagers and the younger generations are often the focus demographic for those concerns. But we have to start to realize that the geriatric population is just as affected by mental health disorders, if not even more. So why is this even important? Well, as some of you may know, the world is becoming gray, which means that the majority of the population is actually within the ages of 60 and above in comparison to those who are 18 and under. The World Health Organization even predicted that by 2030, approximately 1.4 billion people will be 60 years and older, in comparison to only 75.7 million who will be 18 and under. And we can see these trends in nations across the globe, including Japan and the United States. In Japan, we already are seeing a declining population, as those who are age 60 and above is a much larger percentage of the overall population than those who are 19 and below. The United States is following a very similar trajectory. And this is happening because of the increasing lifespan as a result of technological innovations and greater medical cures that are more effective at treating and curing diseases and illnesses. And when you combine this with decreasing fertility rates, we have a graying population. So some of the key drivers when it comes to the mental health issues in the geriatric population include physical decline, ageism, and socioeconomic situation. With physical decline, we often see frailty and disabilities, and maybe even neurodegenerative diseases. When someone has a physical issue, it can often also impact their mental health in ways that we may not see on the surface. For example, medical bills and hospitalization visits can isolate people from their loved ones and maybe even result in the loss of a loved one. This often has resulted in grief and further and deepened social isolation. With ageism, we see prejudice against groups of people based on their age, which has created a stigma around seeking help when it comes to mental health issues. With socioeconomic situation, we are noticing a lack of resources and a lack of funding has contributed to the fact that many people in the geriatric population go underdiagnosed and undertreated when it comes to their mental health issues. And this all continues to amplify the problem. In nations like the United States, Europe, and Japan, we see that the healthcare systems are relatively supportive and do a good job at taking care of their citizens. However, the problem begins to occur when there's a lack of the family support and a well-rounded neighborhood community for these elderly people. This can often result in withdrawal from personal hobbies and not feeling well integrated in the community. On top of that, a large portion of Japan's elderly population is still working full-time jobs. In 2022, about 9.1 million people aged 65 and older in Japan held full-time jobs, which created high levels of stress and great levels of responsibility that not everyone can handle at that age. And now when we look at lower and middle income countries, we see that they're facing a slightly different problem. Here, we see that they have a lack of qualified healthcare providers and a lack of resources and infrastructure to support a stable healthcare system. Additionally, simply someone's economic position and the inability to meet their basic needs is a great stressor that can eventually cause anxiety. Although there may not yet be a solution to the declining mental health of the geriatric population, one way that we can work towards this is to create a supportive environment where the elders feel appreciated and loved. One way that we can achieve this is through spreading awareness. By removing biases about certain age groups, and by more equitably distributing resources among people of all generations, policymakers and citizens just like ourselves can take on a new perspective of the geriatric population to fund where it is needed and not based on stereotypes. Because the goal for elderly people truly is for them to be able to age while maintaining and improving their mental and physical health, all the while creating a stable quality of life. But this will only be achievable if we take the step forward to bridge the gap between not only generations for a better understanding of each other, but also between disparities in the healthcare quality and the resources across the globe. So let's take the time out to be connected to others within our community, even others who may be from a different generation than we are. Because everybody, no matter their age, race, or geographic residence, deserves to have a reliable and supportive healthcare system that truly cares about their well-being. And I think that it's important for all of us to remember that someday each of us is going to be a part of the geriatric population. And when we get there, we would want to be surrounded by the same supportive environment that we can create for them. These are references I used during the presentation. And I'd like to acknowledge the Global Health Leaders Conference for providing me this opportunity to enhance my learning experience and teach myself new things about the geriatric population. I wanted to thank all of you for listening. And if any of you have any questions, please contact me at my email. And I hope you enjoyed.